Hi, my name is Josh, and today we're going to be doing a hip and thigh exam as well as the knee. We're going to be using some interesting techniques due to quarantine. With the hip, the first thing we would do is ask the patient to point to where their pain is. This could be anteriorly, medially, or posteriorly, and each would indicate a different pathology. Anteriorly, it could be something such as hip joint disease. For medially, it could be greater trochanter bursitis, and posteriorly, it could be something such as piriformis syndrome. All right, so the first thing we would do is test for fractures of the hip. To do that, we're going to start with a rolling log. So what we do is we just roll the patient's leg as so. And then we move on to a compression test. We can do this by bringing their leg straight out and tapping on the end of their foot, bending their knee up, tapping here, and then also tapping laterally. If there's pain in any of those taps, then it's likely a fracture. All right, next we're going to talk about range of motion for the hip. So we bring the knee into 90 degrees of flexion and also bring the hip into full 90 degrees of flexion. We would externally and internally rotate the hip. If there's any pain with any of these motions, then there's likely pathology with the hip joint itself. And then lastly, we do a complete sweep of the entire range of motion, looking for any pain. Okay, next we're going to talk about lateral hip pain, which, as I stated before, is often an indicator of greater trochanteric bursitis. So what we want to do is palpate that region where the greater trochanter bursa is. Any pain in that region will indicate this diagnosis. Another common pathology for the lateral hip is something we call snapping hip. So what we would do for this is support the patient's leg close to the table here, and we would bring them into flexion and extension of the hip. Any snapping or pain or popping would indicate this diagnosis. Next, we're going to talk about posterior pain, and specifically at the SI joint. To do that, we would have the patient bring their knee into a figure 4 position, sort of like this, and we would press down on this knee here, and pain elicited at the posterior region would indicate SI pain. Okay, as stated before, another common cause of posterior pain is piriformis syndrome, which compresses the sciatic nerve and causing pain throughout the entire leg. So to test for this, we can bring the leg straight up in the air. If this reproduces pain in the buttock region, then it's likely caused by that piriformis compression. And then we can also bring their knee into flexion and have them stretch over to the side. If this elicits pain in the buttock region, then it's likely caused by the piriformis compressing that side. Next, we're going to talk about the knee. And a common thing that we always will look at first is ligamentous injuries. So we're going to start with the ACL. The first thing we're going to do is something we call the anterior drawer test. So we'll have the patient bring their knee into slight flexion. We're going to sort of sit on their foot, and we're going to pull forward on that knee. Any laxity would indicate an injured ACL. And then next, we would do something similar, a couple of Lockmans that also test for the ACL. And for this, we'll also have them bring their knee into slight flexion. A lot of times, physicians will bring their other knee up to support, and we're just pulling up on that tibia. Any laxity in this can indicate ACL pathology. Okay, next we're going to look at the PCL. To test the PCL, we use the posterior drawer test. Again, the patient is going to bring their knee into knee flexion, but instead of pulling anteriorly, we're going to push posteriorly. Again, any laxity would indicate pathology to, this time, the PCL. Next, we're going to perform what we call a posterior sag test. So to do that, we are going to have the patient bring both knees into knee flexion, and we are going to look at the tibial tuberosities to see if they are equal. Obviously, in our dummy, we can't really tell, but if one was lower than the other, then that'd be indicative of a posterior sag. Moving on now to our collateral ligaments, we would start with the MCL, palpating the medial region of the knee where the MCL runs, and then also, we'll do it on this leg, the LCL, the lateral collateral ligament running from here to here, and just feeling for any crepitus or pain. Next, we would test for stability of the collateral ligaments. For the MCL, we would do a valgus stress test. So we're going to place one hand here at the ankle, the other just at the distal end of the femur, be above the knee, and we're going to push inwards a valgus stress, which would put stress on the MCL. Any laxity or pain would indicate an MCL pathology. And then we would move into a valgus stress test. We're going to also support at the ankle, but this time on the other side of the femur. We're going to push outwards. And this will put stress on the LCL. Any laxity or pain will indicate LCL pathology. This will be done at 30 degrees for both, and at test for meniscus pathology, we would bring the knee into flexion again, and we're going to apply a twisting and a compressive force into that knee. Pain on the lateral side, lateral meniscus, and we would also come at an angle this way, up and down side, internally, externally rotate. Pain on the medial side would be medial meniscus. Another useful test for meniscal pathology is Thestley's test. This can be performed by having the patient stand on one knee, slightly flexed, and the examiner will twist the body. Any pain on the medial lateral side will indicate meniscal pathology. Similar to Thestley's test, we can do something called duck waddling, which will also compress those menisci and indicate pathology. So that's performed squatting down and doing a little walk. Move into patellar pathology. So the first thing to do is a Clark's test. So I would place my hand just above the patella, have the patient flex that quadricep, and I'm resisting the patella moving forward. If there's any pain with this motion and this muscle activation, then it's likely that there's some pathology with the patella. We also want to palpate at the medial and lateral side underneath the patella. So again, hard to see on our patient here, but I would palpate underneath here and here. Any pain would indicate patellar pathology. Next, we're going to do an effusion test for swelling and edema. So we'll have the patient bring their knee into extension, and I'm going to compress the fluid running to the patella and look for any bulges of swelling. Last but not least, we're going to look at tibial stress fractures. So to do this, we would simply palpate the tibia. Any pain or tenderness could indicate a stress fracture. Another way to positively test a stress fracture is to have the patient stand on one leg and do a little hopping. Any pain in localized regions could indicate a stress fracture. Next, we're going to do a little strength testing through manual muscle testing. So first we'll talk about the hip flexors. So to do that, we will bring the knee into hip flexion, and I will try and push down against their quad here, and they'll resist that motion. Next, we're going to do some manual muscle testing of the gluteus medius. One of the functions of the gluteus medius is hip abduction. So to manual muscle test for this, we can have the patient on their side and have them bring their leg up in the air, abducted. And it's kind of hard because our model can't hold their own weight, but they would resist against my hand here as I'm trying to push down. Next, we're going to do some manual muscle testing of the gluteus maximus, which is one of our primary hip extensors. So to do that, they will lay on their stomach. They will bring one leg up in the air, and I will support above their glute here. And with my other hand, I would push down against their hamstrings while they try and resist that motion by pushing up. Next, we can do some manual muscle testing for the hamstrings. We will also have them lay on their stomach and have them flex their knee. And for this one, I would push down against their ankle while they're trying to push up. Also testing for our adductors. So this, they can lay supine. Let me get in a position here where we can see. And I would have the patient bring the patient's legs up, and I would try and pull their legs apart while they're trying to pull their legs in. So they're resisting the motion of me pulling outward. All of these tests we would do bilaterally to compare between sides.